Hello, team and fellow HEB partners. My name is Gabe Rodriguez, and I'm a board certified emergency physician. Today, I will be giving you a little information on COVID 19 and answer a few important questions and concerns that our fellow partners have submitted for discussion. The basics: Coronavirus disease 2019, aka COVID 19, is a severe acute respiratory syndrome that was originally detected in Wuhan City, Hubei Province, China. The disease results from a novel, meaning a new, virus named SARS-CoV-2. The syndrome may lead to serious illness in both the elderly and the immune-compromised population. The U.S. Secretary of Health Services declared COVID-19 a U.S. public health emergency on Friday, January 31st, 2020. It is important that we remain educated, knowledgeable, and remain vigilant in our hygiene practices in order to protect ourselves, our fellow partners, and the surrounding community. The virus is spread most by respiratory droplets, but also from surfaces. Thus, good hand hygiene, social distancing, and regular cleaning of hard surfaces are all keys to preventing the spread of this virus. What are the symptoms? Initially, some people may exhibit a fever, although not all patients may develop a fever, along with a cough, body aches, and nasal congestion. Over 4 to 5 days, the fever may reduce. However, the cough may worsen and lead to chest discomfort and shortness of breath. A small percentage of patients may develop gastrointestinal symptoms, such as nausea, vomiting, and diarrhea. Diagnostic testing. There is a test available for COVID-19. However, current testing for COVID-19 is extremely limited due to the lack of test kits that are available. At this time, only certain high-risk patient populations are being tested for COVID-19, and these patient populations must meet strict standards developed by the Center for Disease Control. What is the treatment? At this time, treatment for COVID-19 remains supportive in nature. This means that we treat the signs and symptoms of the disease. For example, if the patient is dehydrated, we initiate IV fluids. If they require oxygen, we provide oxygen, and so on and so on. Antimalarial and antiviral medications, along with some antibiotics, are currently in their investigative phases. What are some protective measures? Number 1, limit unnecessary travel. 2, wash your hands frequently. 3, practice social distancing. 4, cough or sneeze into a flexed elbow. 5, refrain from shaking hands and hugging. And 6, avoid touching your face, eyes, nose, and mouth. Moving on to some excellent questions from our partners. Question 1. If I'm infected, how long am I contagious? You can be contagious for up to 14 days. That is why the 14-day quarantine period was developed. Question 2. Am I contagious before showing symptoms? Well, maybe. However, if you are asymptomatic, meaning no symptoms at all, the likelihood of you shedding the virus upon others is probably very unlikely, because if you are asymptomatic, you are not spreading germs or bodily fluids from coughing, sneezing, vomiting, diarrhea, and so on. Question 3. If someone is infected and they touch something, what is my risk? Your risk can vary depending on the scenario. This is why it is important to practice frequent hand washing and avoid touching your face, nose, eyes, and mouth. Question 4. How long does the virus last on surfaces? The life of the virus varies according to the surface temperature, surface type, humidity, and several other environmental factors. Research states that the virus can survive from several hours to several days, depending on the factors above. However, please realize that the virulency of the virus, meaning how infectious it is, drops significantly over time. Thus, the virulency at 6 hours is much less than at 20 minutes. Question 5. Why don't we take temperatures before allowing entrance into the building? This practice is becoming more common. However, 2 things here. 1, it would be important to set a maximum temp that everyone agrees is a fever, and use this number as the set guide for fever at all facilities. 2, not all fever that enters a building is COVID-19. There are numerous causes for fever. For instance, a dental abscess, urinary tract infection, strep throat, skin infection, and so on and so on. Question 6. How does someone get exposed and how is the virus spread? The virus is most spread from respiratory droplets, but also from surfaces. Once again, if someone is asymptomatic, meaning no fever, no cough, no sneezing, no vomiting or diarrhea, the likelihood of them shedding the virus is probably extremely low. Once again, my name is Gabe Rodriguez, and thanks for listening today. Good day.